Hi, I'm Dr. Jesse Call from Sycamore Valley Chiropractic. Today we're talking about headaches. Headaches are something that happen to almost everybody. They're really common. They're all over the place. And so we want to talk about what are they, how do we get them, and what are some simple things that we can do to kind of reduce them, reduce the frequency and the severity of them. So the number one most common kind of headache, which is the one I'm going to focus on mostly today because that's what 90% of you are suffering from out there, is called tension headache. And what that comes from, the leading most common cause of tension headache would obviously be muscle tension. So where does that muscle tension come from? How do you get rid of it? That kind of thing. So I want to kind of use a crude example here, and I want to talk about because posture plays a big role in this development of muscle tension. And so what happens is there's muscles that are connected to your neck. These muscles are not postural muscles. You have small postural muscles in between the vertebrae here that are designed to hold your neck up, keep you upright and provide your posture, but you also have muscles that are designed more globally for motion. Things like your upper trap, they help you move your head in all kinds of different directions. What happens is, as we slouch forward and our head travels forward, you can see that tension develops here in this TheraBand as it's kind of representing our muscles. Here it's kind of nice and loose, you can see it there, and as the head travels forward, you see that tension start to gather there. So what happens is this muscle tension doesn't just happen out of no reason, right? So if you can even do this on yourself, if you kind of elongate yourself, get your chin kind of tucked back, and you get your head in neutral, you can feel that your muscles here in your traps and things like that become supple, they become soft, you can move them, okay? But if you keep your hand there and then move your head forward or down like you would if you were on your cell phone, or forward like you're on your computer, you'll feel those muscles start to grab, because those muscles aren't designed to be posturally based. Those muscles are actually designed for the motion. So when the posture starts, the postural muscles, because the system that controls those, regulates those, is not functioning properly, those muscles have to start doing the posture stuff, and that's not their job, so they start to elongate and get pulled out there. And then you start to develop this knot here, and people come to me and say, oh, I carry all my stress in my shoulders. That's not really a thing. Like, carrying your stress in your shoulders, no, what that means is that your posture is bad. You start to hunch your shoulders and your head goes forward and these muscles tighten up, and so you get pain and you start to get these headaches. You feel like somebody's squeezing your head. And because it's coming from these trigger points, you can have them on both sides, and you can even, if they're active trigger points, we can actually go in there and push on them, and people go, oh yeah, that gives me that same feeling of that headache. So the first thing we want to do is we want to mobilize the spine. That's what we do with chiropractic, is we come in here, we mobilize these joints here in the neck using any number of ways to do this, depending on comfort level and what you need, and we mobilize those areas. And one of the other big consequences of that forward head posture, that slumping posture that brings out the tension headaches, it actually compresses the lungs. So it can actually, forward head posture can decrease lung capacity by up to 30%. And so a 30% reduction in oxygen, well, the brain starts craving that oxygen too. And so what it does is it dilates blood vessels. The blood vessels coming to the brain, well, those blood vessels are actually wrapped in pain receptors, so that those pain receptors contribute to the headache. So by helping to restore the posture, freeing up the mid-back through chiropractic adjustments, can actually also help to alleviate the pain and the tension. And when we do the adjustment, we provide a quick stretch on those muscles, allowing them to relax. There's little receptors inside those muscles. The quick stretch, along with restoration of motion, actually allow the body to reset that, helping it also stimulates the extensor muscles along the back of your spine, allowing you to stand up taller. It's one of the things everybody notices when they come out of the office. Man, I feel so much taller. I feel so much lighter. My head feels lighter. My shoulders feel lighter. I don't have this tension in my shoulders anymore. So we've activated those extensor muscles. Now we want that to stay. So by doing posture-based exercises, noticing our posture, doing stretches regularly at our desk, help us to prevent the headaches from coming back and help us to keep those headaches not as intense. So what we want to do, so the takeaway from all this is one, if you have headaches, that muscle tension, the squeezing your head, popping pills, aspirin and Tylenol are not going to fix your problem. That's not what's causing it. Yes, because they block pain from getting to you and your body feeling the pain. And things like Advil have caffeine in them. Caffeine is a vasoconstrictor, so it makes those blood vessels that have dilated with the pain receptor on them actually go smaller. But you still have muscular tension. You still have a brain that wants more oxygen, and you still have that that head going forward, creating that muscle tightness. So you haven't fixed the problem, you just kind of masked it over. It's like putting masking tape over your check engine light on your car and just going, yeah, I'm going to risk it, right? And so what we want to do is actually get rid of the problem, do regular exercises to elongate ourselves, to activate that nervous system, to strengthen the appropriate muscles here, to stretch the appropriate muscles across the front, and to improve our function and improve our posture, not just because it makes us look better, but to reduce those headaches and those posture-based pains. All right, so if you or someone you know about, someone you care about, suffers from headaches, I want you to go ahead and like this and also share this video so that they can hear about it, and also give us a call. It's 925-837-5595. Give us a call, set up an appointment. We'd love to share more with you about this, help you get back on the road to recovery, reduce the frequency of your headaches, and get you feeling better. All right, we'll catch you later.